Coming today. I appreciate that very much. Those are all lies. Don't listen to him. Everything he says is a bunch of no, some of it's true, some of it's not. But what I hope to do today is to impart, utilizing a story of actually now two companies. I'll tell you about the first company in really trying to educate you a little bit about how hard it is to actually discover and develop new medicines and how long it takes to do this. I don't know whether you have gone into the nitty-gritty and detail of how long it takes to discover and develop a drug, but for the pill in the bottle type of drugs that your parents may be taking and some of you may have to take, it takes 12 to 15 years from the time you have a target that you want to work on to the time it's approved and launched. Biopharmaceuticals or biologics, antibodies that are used as therapeutics, it takes about 9 to 12 years. So this is not something for the weak of spirit or people who don't want to persist and people who don't have a passion for something. It's definitely a vocation where if you are passionate about the human condition and wanting to help people live a better life, this is something that you can do, and you can do in I think a way that brings a lot of self-satisfaction and like I said to some of the people I've been talking to today, I've actually been 30 years in the business of pharmaceuticals, and I've only worked 25 years. Pardon me, I've only worked 5 years. The 5 years I had to work was when I didn't really enjoy what I was doing because I was in a situation where I couldn't do what I wanted to do. The 25, creative playtime. It's like being in a sandbox as a kid when you're 5 years old. Creative playtime of enjoying the science that much that you're totally open and you're like a sponge for learning. And the other part that I want to stress today in this talk is really about innovative science, about good business practice and ethical conduct that can lead to successful outcomes. And there's not enough of that in this industry right now, in the pharmaceutical industry, and there's a lot of reasons for that. Some of them I will be talking about today, and we can talk a little bit more in the reception afterwards if any of you have questions. Because I think it's important to understand when an industry has been successful and then it's on the downslide right now for many, many reasons. But we can talk about that a little bit during the Q&A. So Mark discussed a little bit about my background. Actually, my major professors here in the audience, Dr. Majumdar, would you stand up and say hello to everybody? He was, actually, it's interesting enough, I think I have it right. You got your PhD in botany at Kentucky, right? And then you went and did a postdoc for less than a year at Michigan, is that correct? And then you came here to be assistant professor, and I was one of his first honor students to do research and publish a couple papers and give some talks. So a lot of my foundation for what I've been able to accomplish I can attribute to Dr. Majumdar and how tough he was on me, right? So I went from there to UConn before it had a good basketball team. It was in the Yankee Conference then, and they were terrible, absolutely terrible. But that's not the case anymore. And you see, there are people that I'm mentioning in all of these situations. Dr. Friedland, who actually did 2 sabbaticals with Hans Krebs. Those of you who are in biology know about the Krebs cycle. Well, he was in Dr. Krebs's lab, and he taught me everything I know about intermediary metabolism. And then I did a postdoc in a SCORE program. It's a specialized center of research in atherosclerosis with Dan Steinberg and David Weinstein. And that's where I began first working on a statin that never made to market. So I've been very, very fortunate, very lucky. And so you look at this and you say, nutrition, what's biochemistry? He's in the pharmaceutical industry? So the question you should ask is, did he ever take a pharmacology course? Yes, I did. I took 1 course, pass-fail, during my PhD. And I did pass it, so, okay, I did pass it. But he started businesses, two Asperion twice, but I don't see any economics or business up here. Yes, I've started 2 businesses, and the reason I've been able to do that is because I have been very fortunate and very lucky to work with people who are different in their expertise than I have, yet we have this mutual respect, and we have a vibrancy of teamwork between those people that I've worked with who have taught me an awful lot about venture capital, a lot about the business of the science. And obviously, I didn't take the course, but I experienced a life experience that probably teaches me better than taking any course. Oh my gosh, look at this. What's he going to talk about now? So my big farm experience, after I did my postdoc in San Diego, some people still ask me that question. So why did you leave San Diego to go to Ann Arbor, Michigan? Well, there were good reasons for it. It wasn't the weather, I can tell you that. But I became a scientist there and then eventually chaired the atherosclerosis drug discovery team, where we had 11 lead compounds in 12 years that I ran it. We identified this parole series, which led to 5 lead compounds. The 5th one was Lipitor. The first 4 were quote-unquote failures because they had some sort of black mark on their pharmacologic profile. I look at that as not failures. I look at that as learnings, because the experience that you have in doing and changing certain functional groups on the molecule to alter its potency and its efficacy is what we learn from in order to be able to discover this compound, CI981 atorvastatin calcium, or Lipitor. So I'm the co-discoverer and product champion of Lipitor. When people wanted to walk away from it because it was the 5th statin, I'm the guy who got in the way and said, no, you can't do that. What's the reason you want to stop developing it? Management was very much down on it because they had an ACE inhibitor, an antihypertensive drug, which they thought was going to make billions of dollars, and it never even sold $1 billion. And here we have this situation where this is the 5th on the market, and they didn't think it was going to work. But I kind of put my proverbial neck in the guillotine, and fortunately the guillotine never came down. We filed the IND, which is the Investigative New Drug application that allows you to go into humans. The NDA 6 years later, which is actually very fast for drugs that are used for preventative purposes. And it sold $1 billion in 11 months, the fastest launch in the history of the pharmaceutical industry. And at its peak, it was about $13 billion. As I say to people, I've never sold a pill of Lipitor. Never sold a pill. I'm the guy who just did the research with a great team, both the preclinical research and the clinical research, to prove what its attributes were and to prove that it could potentially have beneficial effects on reducing heart disease and the risk of heart disease in individuals who have high bad cholesterol. This has been chronicled in a couple of books. Bob Shook wrote a book called Miracle Medicines, where he highlights 7 different medicines over the past 20 years that have really changed the course of how medicine's practiced. And also Zhi-Jack Lee, who wrote the book Triumph of the Heart, which is about the story of statins. So, issues. The time frame of 1998 to today. Okay, what's going on in the pharmaceutical industry that's prompted all these incremental exponential changes? We know that huge consolidation has occurred over the last 15 years, where there were 10 or 15 different middle-sized pharma companies. They're all gone. They've been gobbled up by Pfizer, most of them. And unfortunately, now that the industry has had failures in phase 3 of development, where you're just about ready to get your drug approved and something happens, then you contract the industry. So we're in a state of contraction right now. This is a bit of a roller coaster that a lot of industries have when, for some reason, innovation isn't as great or as focused, or you don't have that serendipity that we had in the Lipitor story. And it just doesn't, compound's no good, doesn't make it. And I'll tell you a story about that related to my individual situation, which changed my life as well. What critical business factors provided a template for the establishment of new life science and biotech companies? Well, if you don't like working in a big organization, guess what? You got to work in a small one. And a small one's a biotech company because it's usually venture-backed, and you're usually trying to find something that Big Pharma just said, nah, that's not going to sell us $1 billion. We don't want to work on it. But it may be critically important for a specialized group of people who have a specialized problem. And then, of course, the financial conditions. What have they fostered? Rapid growth and development of these innovative companies. That's a plus-minus right there, because it depends upon the economic conditions in which we live. So the factors of innovation in cardiovascular franchises. I'm going to focus on that today primarily. And this increased merger and acquisition activity and the reorganizations lead to consolidation. But what does that do to innovation? What if you have 13 or 17 or 20 layers of management from where you are to it gets to the top of the company. Do you think that novel idea is going to bubble up? Do you think it's ever going to reach to the point where the decision makers are going to be able to say, that's a great idea? In the companies that I've been in the last, except for 3 years when I was part of Pfizer, in the companies that I've been in the last 12 years, they're flat. They're flat structures, basically. So there is no layer. Those people are able to come as a group and present their ideas, and we debate over them. And we kind of ruminate over them, noodle over them, so to speak. That's what's happened to the auto industry in Detroit. In Detroit, we're trying to upgrade it a little bit. Detroit, Michigan, where the auto industry is. There's only one person who speaks French, obviously. Anyway, what happened there? Consolidation. All that consolidation. What happened to the innovation in the auto industry? Too many layers. Never bubbled up. And, oh, we'll put blinders on. There's no global economy out there. Forget it. There's no global economy. And what happened? Yeah. The government bailed them out because they went bankrupt. Okay? So looking at this, this is what happens with consolidation. You don't want duplicates of cardiovascular groups or athero groups. So one of those companies loses it, and those people scatter to the winds. Where do they scatter? They come and be part of biotech companies, and they regain their passion and their focus. This integration leads to chaos, a lack of focus. All of you know how you feel, right, when you are outside your comfort zone and you're really immersed yourself into something that you really, really enjoy. Okay? How do you feel? You feel great, don't you? You feel empowered. You get energized when that happens. Okay? A little bit of chaos is good to take you outside your comfort zone and have you start thinking creatively. You start thinking about questions differently. You're thinking about your life differently. Too much chaos is what we have in the pharmaceutical industry right now. And then all you're doing there is trying to hold on because you got a house payment and you got 3 kids and you're wondering what's going to happen to your car and everything else that you have, as well as your children's education. So that loss of continuity and that institutional memory really hurts large companies. Within 5 years after Lipitor was approved, anyone who had anything to do with that drug was gone from that company. So there's no institutional memory. You can't go back and look at old data and say, what are we going to do? We've got a problem here. That whole idea of a blockbuster mentality. A blockbuster's definition sells $1 billion. But was the question ethically, is this going to really be good for these people? Is it safe? Is it efficacious? Are we putting a blind man's eye to any side effects that may be showing up? Big Pharma has come under some pretty tough, under the microscope and some tough scrutiny and class action suits as a result of not doing things ethically correct. That unrealistic failure of blockbuster mentality and particularly failure of combined treatments. If you have this drug alone and you have this drug alone and you have really good results, what if you put them together? Maybe you'll have something that's additive or synergistic. Maybe you'll also have something that's additive and synergistic not for efficacy but for toxicity if you don't test it. And this is what people do. This is what sometimes the industry does. And then this idea of unwilling to take risks and invest in long-term morbidity and mortality studies. In other words, is it cost effective to treat somebody on Lipitor for 10 years if this person has a risk and their mom and dad died when they were in their 40s? And this guy lives to be 65 or 70, and their quality of life is really good. Is it cost effective to do that? How many people do you need to treat to show that you're having that benefit? Very important questions that people have to ask themselves. So, with the consolidation of the industry, people not wanting to stay in large companies, what happens? You have a great opportunity outside of big pharma to work with small, focused franchise players, as I call them. So, for me, the road to innovation leads you back to the basic science, okay? To understand the disease process itself and be best in the world in a specific therapeutic area that you're focusing on and that you're passionate about. Integrating genomics. When everybody thought, well, when we know the human genome, we got the blueprint of life. But people forgot that blueprint has to work in some sort of environment. And the environment that all of you live in impact how your body responds to your environment. Whether you exercise, whether you eat right or you don't eat right, whether you smoke cigarettes, you drink too much alcohol, whatever it's going to be, that lifestyle impacts your genetic blueprint, positively or negatively. Everybody thought, well, when they discovered the gene for cystic fibrosis back in 1987, this was one of the first times that somebody discovered that you had one gene that potentially can impact that disease, which is a horrible disease for people who have it. They predicted in 5 years we'll have a cure for it. That's 1987, 88. We're in 2011. Do they have a cure for cystic fibrosis? No. Do they understand it better? Yes. The other part here is, I think, really important, and that is the devices that we can use now, such as imaging techniques. You can look at a very small population and get a clinical readout that says to you, you are going down the right path. You are showing an effect of shrinking those cholesterol-laden plaques in your artery and reopening up that vessel so we can flow more blood, particularly oxygenated blood, to parts of the heart, the brain, the extremities. You've never had that before. So this is a way that we can actually get a picture of what's happening in somebody's body after treatment. So every cloud has a silver lining. Opportunity abounds even in the hardest of times. Keep alert and weigh your options. Even in the toughest times right now, when you look back at the golden age of investment in biotech, $40 billion in 2000, billion, not million, billion, went into biotech in that year. In 2001, a year later, after 9/11, okay, that dropped down to 20 billion. Last year it was 6 billion. So guess what? There's a lot of hungry small biotech companies, and there's a lot, not very much cash. A lot of them go hungry for cash and capital that allows them to grow their idea and move forward. So, why do I show you this book? Well, this book impacted my life in a major way. What I haven't told you is that after, just as we were going to file the NDA for Lipitor, I came into my office on, we called it Black Thursday. It was the Thursday before Good Friday. And I'm looking at my boss, and his neck is all red, and he's nervous, he's kind of jittery. And I'm saying, oh, something's going to happen. And he said to me, so I sat down, and he said to me, we're going to merge atherosclerosis, which is your group, and cardiovascular. And I said, who's going to run it? The person who runs cardiovascular. And I'm looking at him, and I'm saying, how many lead compounds has that guy had? 3 in 11 years. I've had 11 in 12 years. So what are you trying to tell me? You trying to tell me you don't want me to work here anymore? You know, I gave you 15 years of my life working on Lipitor, and this is the thanks I get. So anyway, I never got an answer to why that ever happened, by the way. But I realized that I couldn't continue to do the science, nor could I continue to work with people that I couldn't trust. So, Borders Bookstore was founded in Ann Arbor, Michigan, and I was at the Borders downtown Ann Arbor on a November day, and I was really trying to figure out, this was in April of '96 when it happened, and this was in November of that same year, and I'm trying to figure out what am I going to do next, because obviously these people are giving me a sign. We don't want you around anymore. And so I knocked over this set of books that was right close to a corridor there, and this is what I saw. Don't let your company kill you. And I'm going, whoa. Thank you. Thank you. And I turned it over and I saw Deep Change, Discovering the Leader Within by Robert E. Quinn. I started reading it, didn't even look at the leaflet to find out that he's a professor at the University of Michigan in organizational psychology. So I call him up and I say, Dr. Quinn, this is a person who works over at Park Davis just across campus. How are you? Again, I never thought this guy would even give me the time of day. He gave me the time, not only did he give me the time of day, we went out to lunch. He spent 4 hours. I thought it was going to be an hour. He spent 4 hours hearing my story. And he said, well, I think you need to leave. I think you need to go someplace else, find another job. And a couple months later, I called him back up and I said, I finally decided to leave. He says, okay, let's do lunch again. And this time, remember, he's a psychologist. He turned me inside out about 4 or 5 times, trying to figure out, did I have the intestinal fortitude? Did I have the passion and spirit to start a company? And most of all, was it going to be a situation where my family would suffer and I would suffer at the same time? 4 hours later, I'm exhausted. And he says, I think you've got the grade. I think you're ready to go. Thanks. I'm ready to give my resignation tomorrow. And basically, that's what I ended up doing. But this book changed me. It's a great book if you ever want to read a book about leadership. And my favorite quote in the book is, walking naked in the garden of uncertainty. Think about that. Yeah. Okay, well, that's what I did, but I wasn't naked, and it wasn't as uncertain as I thought. So the other thing he said, if you're going to go and start a company, you've got to consider, okay, certain things about that. For example, you want to stay in a stable, low-risk, comfortable, but compromised setting? That's what I could have stayed in at Warner Lambert Parke Davis, but that would have been a huge mistake because, first of all, it was not a stable, comfortable, low-risk setting. Hell was coming. In other words, basically, all this consolidation, people were going to lose their jobs, people have to move on to other things. It was not fun. So, or start anew in a high-risk, uncertain future. I'll go with that one any day, especially when you have co-founders with a common vision, a willingness to embrace risk, assess appropriate levels of financial support, in other words, capitalize the company, and a proven track record of success. So when I used to go and raise money around the world, and there were people gray like me, I wasn't gray then, but gray like me, someone had to be on a statin to lower their LDL. And when I told them that my team, 3 other people, Tom Ria, Charlie Busquera, and Mike Pape, who were co-founders, worked on Lipitor, then things changed. So having a success is a huge plus in being able to start companies. Bob Quinn also said you have to have a name that really means something. And what David Shear, who initially, he's from Connecticut, and he's a consultant to some venture capitalists, when he called me up to see if I wanted to start this company, Asperion, he said to me, tell me, what was so great about your group at Parke Davis? 11 lead compounds in 12 years. That's almost unparalleled. I said, esprit de corps, a common spirit existing in members of a group, inspiring enthusiasm, devotion, and comradeship. And my wife one night woke me up at 2 o'clock in the morning. We were trying to find a new name for the company because we were going to call it Meta Pharma, changing pharma. You know how many meta companies there are? 250. So that we wouldn't have been too distinctive. So she says, esperar. Esperar. To hope. And the suffix ion, meaning activity or process or resulting from, came from one of our co-founders, Tom Ria. I was thinking about, Esprit Pharmaceuticals, there's Esprit Clothing, there's the magazine. I said, no, we have to have something that's really a unique name. So if you Google Asperion, the only other thing that will come up is the municipality of Asperion on the island of Corfu. I'm sure some of you don't even know where Corfu is, but that's okay. It's in the Adriatic Sea. Anyway, so our mission was dedicated to discovering new therapies through vibrant teamwork in the hope of treating patients with cardiovascular and metabolic diseases. Bob Quinn says to me, now you don't want to have the 10 Commandments because those are thou shalt not. You want to have thou shall. And so respecting individual dignity, vibrant teamwork, excellence in science. Extremely important. When things got really tough, this is what I could refer to help people stay on focus and not get too crazy on me. Particularly when I had to lay off 25% of my workforce in 2002 because there was it was basically an ice age of venture capital at that time. Everything just dried up. And you want to have a purpose to explore, create, to build, to do something that's anabolic, not catabolic, something that's building, that you grow on and you can grow together with. And the vision, obviously, of discovering new therapies using approach which integrates both traditional and cutting-edge theories and technologies. Another thing, he says, you got to have a photo. You got to have something that, and a byline, Pathways to New Medicines, which we trademarked. And you got to have something that stirs people, gets them not in their head, but more in their heart. And this photo I happened to see when, this is in Lake Michigan. It's at a place called Empire Bluffs, and this is a pathway to New Medicines. And this gentleman here is with his grandchild. and he had severe heart disease. And our therapies helped him be able to walk this path and look at this beautiful vista with his granddaughter. Now, some people might think that's pretty corny. I don't think it's corny at all. Matter of fact, people who worked for Esperion camped right here and found this because it was that meaningful to them. And Knut Hill was the person who, when I asked, was a good friend of mine who married actually a Lafayette grad who came to work in the lab, one of Meredith Davis. And he said to me, I brought this up at a town hall meeting, and I said, what does this mean to you? And that's exactly what he said. And everybody just said, wow. We had a town hall meeting every month, and we brought in people, grandfathers, uncles, people who had had heart attacks, and we heard their story. And talk about a motivator. That's a major motivator, let me tell you. So, little science for some of you. Heart disease, #1 killer. 65 million Americans have it. A lot of them don't know they have it. 1/3 of adult Americans have cardiometabolic disease. These are people who are overweight, who have hypertension, bad lipids, inflammation is up, and they usually have high hypertension as well, high blood pressure as well. 20% of all individuals have low levels of the good cholesterol. Does everybody know what the LDL cholesterol is? That's the bad cholesterol. That's that builds up in the arteries. The HDL is the good cholesterol that pulls that cholesterol out of the arteries and takes it back to the liver for removal. So if you don't have a functional HDL and you have low HDL, guess what? Your disease increases dramatically. Your risk of having a heart attack increases dramatically. And most importantly, from a business point of view, there's no drugs that are indicated for HDL at this point in time. So we were on the cutting edge of moving forward, hopefully being able to push medical practice to a higher level. So I showed this, this Newsweek article, Function of HDL and Esperion Solution. And it's basically, it's not because I'm from Detroit now. This is not the HDL automobile company, okay? The LDL accumulates right here, like I just said. And then the HDL offloads it, and HDL hard at work here. And basically what it does, it takes the cholesterol back to the liver. And in the liver, you could remove the cholesterol, 1.5 grams a day, through biliary sterols or bile acids that help you digest your fat every day. Those of you who have taken some nutrition courses might know that. And so what we decided to do, we're going to make HDL outside the body. We're going to make synthetic HDL, okay? And we're going to use a recombinant protein technology. In other words, we're going to put a transcript of a gene into a cell that will produce a protein that we want to use to mimic the major protein in HDL called ApoA1. And what that ApoA1 does, it pulls the cholesterol out of the artery, and these discoidal particles that you produce in your body every day, we basically mimic that. 7 to 12 nanometers in size. So they're small, and they're discoidal. And they're complex, the protein's complex to phospholipids, so it's soluble in the aqueous environment of your blood. And that as it gets larger and larger, it's picking more and more cholesterol up, more protein and more phospholipid. And eventually it dumps it off in the liver, and it goes back to becoming a discoidal type particle. And it then is eliminated as waste. And what our thought process was, and there's plenty of preclinical data that I can't share with you today, to show that in animals that get atherosclerosis due to diet, feeding them high-fat, high-cholesterol diets, you can actually show regression of plaque. Progression is when you start with this and go like that and end up with basically the cholesterol here. Regression is just the opposite, to take that plaque away, remove the cholesterol, and perhaps prevent rupture of the plaque to cause heart attacks. So another important discussion point was, who do we treat? And the ACS subjects are, there's 1.7 million ACS subjects now in 2011. In 2000, 2002, 2003, there are 1.4 per year, new ones every year. And these are people who have heart attacks, who survive their heart attacks and get treated with all these different kinds of medications. But none of them really attack the arterial wall like HDL does, okay? Revascularization, obviously, is something that does, because then you get in there and you root out the plaque and you reopen the vessel so the blood can flow. But what we wanted to do is see whether we could have effects on these unstable plaques that are about 20 to 50% stenosis, of closure of your vessel, and whether we can prevent them from rupturing, which cause most of the heart attacks, 85% of the heart attacks. So we have to measure something. We have to have some idea of how are we going to show, what are we going to measure, what metrics, what measures are we going to use to say that we have something that's actually working. Okay, so we infuse these synthetic HDLs that we make into a peripheral vein, such as in your arm, and it circulates through your whole body. The half-life of that protein is 3 to 4 days, so a resident time would be around a week. So we give this once a week, and then we'll evaluate what happens. And what happens is plasma-free cholesterol goes up because you're mobilizing cholesterol out of the artery. Phospholipids go up because you're infusing phospholipids, plus you're causing an increase in the amount of cholesterol being pulled back, and those particles get larger, so your phospholipids will increase, and both of these will change as well. Elimination. Well, this is not something I knew I didn't want to be a gastroenterologist, because basically I wouldn't want to collect feces for 9 days like they did at the Huddinge Hospital in Sweden, where they gave a synthetic HDL and then collected the feces of these individuals and evaluated the fecal sterols and bile acids and found a 35 to 40% increase in fecal sterols and bile acids as a result of infusing this HDL. This whole process of reverse lipid transport was enhanced. This whole pathway, getting rid of the cholesterol, was enhanced as a result of giving the HDL. And then structure function here, as far as the vasculature, we chose atheroma volume, but you could use vascular reactivity or look at blood flow volumes. You know, people who have situation where they can't pump enough blood, you know, their ejection fraction's reduced. Perhaps we could show an improvement on the blood flow and the ejection fraction that occurs in heart failure. But we chose to look at atheroma volume, and we chose an imaging technique to do that. So what did we create in the first Asperion? Well, we created biopharmaceuticals for subacute treatment of athero. Rapidly infuse these therapies to stabilize and regress plaques. Hopefully it will reduce the cardiovascular events. We never got to that, unfortunately, and I'll tell you the reason why. Or affect the broad potential of high-risk atherosclerosis patients, people who may have survived a heart attack or stabilized. And then we also had these small molecules that I talked about earlier. Okay? Okay, this is the marriage of business and science. Okay? You can't do what you want to do unless you have something that somebody wants to invest in. So what we did is we rapidly went out and in-licensed intellectual property from 4 different companies, okay, that weren't interested in pursuing this HDL gig. And what we did is we went to venture capitalists and raised $16 million, went to the Swedish Industrial Development Fund. We actually signed on one of these projects called ApoA1 Milano. I went over to Sweden. I'm a half-breed Swede, so I went over and learned a little Swedish to impress them, and signed the deal to bring that intellectual property in June of 1998 in what they call Midsommar, or which is basically the summer solstice. Had a wonderful time over there, and we convinced the Swedish Industrial Development Fund to give us $6 million, and then went and raised another Series D of venture capital. And you can see what they were basically financing were these potential HDL products. We were the only company in the world at this time that was working on this. So we basically had a monopoly of sorts, because this is what, that's not the case now. There are a number of other companies doing it now, but we were the only ones. And so we continued with our small molecules, which we've done while we were at Parke Davis. We had our IPO 25 months after we started the company. Now it's 7.5 years after you start the company. And we started it, we did our IPO even before we started our phase 1 study. Now you have to be probably through phase 2, or where you've actually shown that the compound has effects in the population for which it's indicated. We did a private investment in the public entity in 2001. We did all our financing in June and August when everybody said you couldn't do it. That's why we did it. So instead of being there when there were 9 companies in line, there were 2. Instead of getting a half hour to present your corporate presentation, you got an hour and a half. And it paid off, because we were the only ones in the world doing this. So it made a lot of sense that if you want to invest, here's the opportunity to do it. And so we eventually got to phase 2. Trials started, and we eventually got our proof of concept trials. And here's the company downsizing I mentioned. That was the toughest thing I've ever had to do, is say goodbye to fabulous scientists and people. And our secondary round of financing was done in August of 2003, after we had learned that we had had a beneficial phase 2 study. So why do I show this book? This is a great book as well, Good to Great by Jim Collins. It's a book that I think changed my life in a lot of ways because it was given to me in December for Christmas over the holidays by one of my co-founders, Mike Pape, right after 9/11. And it taught me an awful lot because it basically said, if you're going to be successful, you have to really follow the hedgehog concept. And what that is what are you deeply passionate about? What can you be the best in the world at? And what drives your economic engine? Well, we knew these two were no problem. This was the part that really made it difficult for us because we spent 8 weeks figuring out that we had to lay off 22 people to save $10 million because we had to put that $10 million into our clinical development. Tough decision. My family went on vacation for spring break. I stayed home and fired people. Had to let people go. We didn't abandon one of those people. Within 9 months, all those people had jobs. We helped them find jobs. We never abandoned them because they were part of our original Asperion, and interestingly enough, some of them have come back to work in the second Asperion. And so you got to treat people as you would want to be treated yourself, and we never abandoned them. And then we also learned a lesson from a veteran of the Vietnam War, Admiral Stockdale. Anybody know who he is? Besides the fact that he was the vice presidential candidate with Ross Perot at one time. He was 9 years interned in the Hanoi Hilton, which was a prison in Hanoi. He had his legs broken, his ribs broken, and he's a great leader, and I think somebody who's really inspirational. One of the things, if you're going to be successful as a business person, starting a company and moving forward in that, you've got to be brutally honest about your prospects, about your funding strategy. Reaching too far is as bad as not reaching high enough. And most importantly, I'll paraphrase what he says here. Be forever hopeful, but deal with the harshness of your reality. And the harshness of your reality, for a lot of people right now, is going back to community college to retool themselves at 50 years old because they lost their jobs. That happens in Detroit all the time. People who work for the auto industry are now having to go back and retool because there's no jobs. And that's one of the reasons why we have one of the highest unemployment rates in the country. But these people are being brutally honest with themselves. And that's what a researcher has to do. If your data tells you to stop or you have a side effect, ethically you have to stop allowing people to take drug. Ethically you do. And what is it? What is the percentage, the magic percentage, ethically, of some people dying of heart attacks because they're taking COX-2 inhibitors? Is it 3%? Is it 10%? Is it 0.5%? I don't know. But ethically, you have to report that if there is a side effect like that. So here's what we had as far as our compounds. There were 3 compounds that were biopharmaceuticals. This is the one I'm going to talk most about today, 216. Small molecules were 1001 and 1002. This is the one that started the second Asperion, the second round of Asperion. I was able to pull it out of Pfizer after they closed this down. But here we are. I wish I had a glass of Chianti to serve all of you, and I wish I had a little bit of Italian music. That would be great. This is on the northwest shore of Lake Garda, which is a beautiful glacier-carved lake in northern Italy. And Limona sul Garda, take a one guess at what they make there. Lemons. Yeah, they grow lemons. Limona sul Garda. And the person who carried this gene, which was discovered in Milan in 1979, which is about 2 hours from here, Guido Franceschini and Cesare Sirtori, they discovered somebody who had an HDL of 7. Boys, gentlemen, your HDL should be around 40. Women, premenopausal, should be around 50. He had an HDL of 7. And these guys are scientists, and they're rubbing their hands together saying, this guy's got to have heart disease. He's got to have heart disease. He didn't have heart disease. They're scratching their heads. They can't believe this. 7. Well, he had a mutation. He had a variant. He had a cysteine for an arginine residue. And cysteines, those of you know, cysteines can form disulfide bonds. So two molecules can come together of ApoA1, which is the major protein here, and you get 2 for 1. And they're anti-parallel to each other. Okay? One's clockwise, one's counterclockwise. I'll show you that in a minute. But they circulate primarily as dimers. They give this perceived phenotype of having no HDL. And you're going to get a heart attack. He didn't get a heart attack. Mild hypertriglyceridemia and this paradoxical resistance to heart disease. So what they did is a gain in function mutation, which is very rare. Often deficiencies cause defects. And what they did is they went into this church here, the Church of San Pietro. And they went through 6 generations of records and family trees, did a pedigree from where the proband was, the individual who had the HDL of 7, and went all the way back to the mid-1700s. And they found that people who had this rare mutation lived 10 to 15 years longer than the average person in the village of about 1,000. So there were 44 of these people who were heterozygote, okay, and they're called protatore. And the Italians here, protatore, you know what that means? Carriers, okay? And unfortunately, they have no homozygotes, and maybe you can't have a homozygote that has ApoA1 milano. So from this, these 2 investigators patented the protein, and they sold it to Pharmacia. Pharmacia merged with Upjohn, decided they didn't want to develop it, and guess who got it? Yours truly. That's when I was in Midsomen in Stockholm, signing to get the IP of the capability of being able to make recombinant protein that basically is the same structure as this variant, okay, as a synthetic HDL. This is what it looks like. This is what I meant by anti-parallel. Here's your cysteine residues, and the molecule on the top of this Eskimo pie, if you will, is going counterclockwise. The lower one is going clockwise, okay? And the residue, H17, happens to be very important for cholesterol removal from cells, from the membranes of cells. It's a very important one for that process to occur. And fortunately, there's 2 molecules in these people, and there's only 1 in us. And so it's very different. So what about these carriers? Well, they're protected against heart disease. What about A1 Milano? It enhances reverse lipid transport. We know that already. Transports excess cholesterol from the artery for its removal, and the anti-atherosclerotic effects have been shown in preclinical models. Rapid plaque stability, inhibiting progression, promoting regression. And our target population was the 1.4, now 1.7 million acute coronary syndrome subjects, people who come in with heart attacks or severe angina. So what we did is we sought this recombinant protein to regress the plaque. And we evaluated this. It was called ETC216. We evaluated 5 weekly infusions to see if we could actually significantly regress the plaque. Now, people told me, even a Nobel laureate once told me, I don't think it's going to work. The guy who was the primary investigator at the Cleveland Clinic gave it a 1 in 10,000 shot. But they hadn't looked at all the preclinical data, and there were 48 studies, preclinical data, that showed you could regress the plaque or inhibit its progression. So that's why I said it wasn't that big a risk, I don't think. Anyway, so what we did is we treated a small number of individuals with 20 to 50% stenosis using an ultrasound 40 megahertz transducer at 0.5 millimeters per second through a greater than 30 millimeter single target artery, 12 placebos, 23 in the low dose of 216 or 15 milligrams per kilogram, and 40 milligrams per kilogram, 22 patients. There were 7 patients that withdrew in the high dose group. 2 of those we think may have a sensitivity to phospholipid, and there's about a 7, in the case of general population, about 10 to 15% prevalence of potentially a response to the phospholipid that ETC had complexed itself to. So what do we do? Well, what we do is, this is the probe, this is intravascular ultrasound probe, and this is the lumen of the vessel, and you can see this contrast here. This is the external elastic membrane, and all this other, which is traced here, is atheroma. This is the atheroma with the greatest thickness. So what we're trying to do is shrink that plaque, shrink it as best we can. And so what did we do? Well, we evaluated and combined the 2 treatment groups as part of the protocol, and we're able to show a 4.2% reduction in atheroma volume. That doesn't sound like an awful lot, does it? Well, it's never been shown before, and atorvastatin calcium, or Lipitor, over 18 months, at the highest dose only showed a 0.4% effect. So LDL doesn't have an effect of mobilizing cholesterol from plaque. We also wanted to look at the 10 millimeter worst segment. We did that as well, and we found, whoa, 10.2%. That's a little better. So the worst atheroma had the greatest effect, which is exactly what we wanted to show. And why do we think this is important? Well, Cy Glagoff, who was a pathologist at the University of Chicago for many years, what he showed is that there's a compensatory expansion of the vessel itself to maintain the lumen until you get to a point of severe atherosclerosis. So if we could potentially catch somebody with a 20 to 50% stenosis, we could possibly reverse the process. In other words, make somebody's vessels look younger and act and function younger. And that's exactly what we did. Because what we were able to do is reduce, you could see it better here than here, but you could actually reduce the atheroma volume as shown here. And basically in this individual, which was one of the best, their plaque area was 9.7 millimeters squared, and after only 5 infusions, after 6 weeks, was reduced 30% to 6.3. So what does this tell us? Well, this is a proof of concept study. This is one of those experimental designs that the NIH is trying to put forward and FDA is trying to put forward as well. We could not directly compare treatment groups. The IVUS progression rates, we don't know what that's going to do as far as effects on morbidity and mortality. And that's what really needs to be done now at some point. But this was done in 2003. This was published in JAMA in November of 2003. So what happened? You know, what happened? What happened to this great finding of 5 infusions regressing plaque and showing for the first time how dynamic atherosclerosis and coronary heart disease is? That you can remove this vessel and those HDL trucks can do their job. Well, we thought we could sell it to somebody, and we did. So after that study was published and presented, we showed all the attributes of rapidly illuminating cholesterol, modifying therapy of unstable plaques, affecting heart attacks and strokes potentially, working with statins. The lower the LDL, the higher the HDL, the better. And this was the only subacute or acute treatment. And so what we became, in a matter of 6 weeks after that was published, there were about 10 companies that were interested in buying us. And guess who won? Pfizer. They gave us a 55% premium on our 20-day stock price, which back in those days was unheard of. We were a 5.5-year-old company. We had raised over $200 million in venture and equity capital. And they bought us for $1.3 billion. It was announced on December 21st, closed on February 10th. And we operated for 3 years as a Pfizer Inc. company. So what I did is I took 25% of my gross proceeds and I established a family foundation called the Esperance Family Foundation. And the college here has been a benefactor of some of that money that came from that sale. And our focus is on human potential, social justice, health, and the environment. That isn't what my kids wanted me to do. My kids wanted me to buy a 20,000 square foot house. They wanted me to have a indoor swimming pool because Michigan can get pretty cold in the wintertime. And they wanted to have a 5-car garage with, I can't tell you how many Maseratis and Ferraris. And I said, not. Forget it. Forget it. Okay? Forget it. And so we've done some wonderful things as a family foundation. And it's a way of giving back. It's a way of giving back. So think about that. Some of you are going to do very well in what you do. But think about helping out others, you know? And particularly people who don't have much of a chance of really improving themselves. Think about helping them out. Well, look what happened. Here we are, February 2004, May of 2007. So some of you must be scratching your head and say, what the heck happened? What happened? What's this all about? Well, we thought that since Pfizer was at that time the world leader in cardiovascular disease, our focused therapies and the Pfizer skills and resources and an unmatched ability to move product candidates forward, that this compound would go through in a matter of 4 or 5 years. Yeah, okay. We thought that since they have loads of money and we didn't, we had $100 million in the bank when they bought us, that perhaps, you know, these financings and publicly traded entity alone, you know, let's face it, we went out at 9, we went to 21, and we stayed during the 18 months of the frozen winter of venture capital, we were at 3 and change. And if you bought Asperion stock 15 months before the actual deal was done, it was at $5 a share, and you could have made 7x on your investment. That's not what's important, though. What's important is, would Pfizer allow Asperion to function as an independent entity within its existing infrastructure? They wanted to basically merge us in, integrate us into Pfizer. And I really had a hard time over that holiday vacation after it was announced, because I was trying to figure out a way that we could keep our group together. And so what I did is I went back to the senior leadership at Pfizer and I said, if you don't transition us into a independent entity, a Pfizer Inc. company in a separate facility, you're going to lose half your investment. And they looked at me and they said, what are you talking about? Half of the investment. I said, my people are going to leave. I don't believe that it's just the IP, the patent, the technology. I believe it's the people. And I think it's 80-20. But I didn't want to tell them that either. You know? So I convinced them, took 6 weeks and went up high up the chain. We were a separate entity in Plymouth, Michigan, and we're still in the same facility that we moved to. But what happened was there was a line extension. Line extension, for those of you who don't understand in business, is when you have something that's patented and you want to extend the patent life and its use. Because you know what happens when patents expire? Lipitor's is going to expire in November of 2011. You lose about 80% of your revenues in a matter of a year and a half to 2 years. So if you've been used to, you know, over $10 billion and you go down to 20, pardon me, $10 billion you go down to 2, that's an $8 billion difference that you have to prepare for. And if you have a lot of mouths to feed and people who are working there, it's going to be tough to deal with. So what they did is they decided to close all the R&D facilities because they lost $1.2 billion on this drug, this combination. And so 2,400 people lost their jobs in the state of Michigan. All the R&D facilities were closed, including Asperion. We were the first to close because we were the smallest in May of 2007. So I said, well, I'll tell you a story. In December of 2006, my boss calls me because it's part of our performance appraisal, and he says, so what are you going to be doing next year? I go, personally or professionally? Both. I said, hey, John, you could be straight with me. What's going on? He says, I don't think Asperion's going to make the cut. I go, what do you mean make the cut? We're going to cut facilities and we're going to cut heads because we just lost $1.2 billion. And I said, well, can I get the name back and I can get back some of the IP? Didn't take long for me to figure that because I knew this was going to happen sooner or later. So what I did is I initiated the negotiations with Pfizer in May of 2007, and we lined up capital a half a year later of $22.75 million. And it took us 50 weeks to negotiate, to sign the agreement, to get the former patent estate of ETC 1002, that small molecule I mentioned in our portfolio, and acquire all the former Asperion instruments and equipment at a discount, 30 cents on the dollar. So we were able to get all that equipment, and we also were able to get the building, which was great. For my sweat equity team, about 7 members of my team from the previous Asperion, and they became our core team. And what we were able to do is get the governor to call Jeff Kindler, who was then chairman and CEO of Pfizer, and he agreed that the building that we were in, since they had invested $8 million to renovate it for us, should be used for pharmaceutical R&D and not for Japanese auto supply dealership company that was our next door neighbor who wanted to buy it and make it into their North American headquarters. So we had a lot of people to work on this, and we were able to establish it as the Michigan Life Science and Innovation Center. 2 years later, there's 95%, it's 95% full. There's 19 companies there, and a lot of good friends of mine who never left the area after the closure. And we are rejuvenated and not retired. Retired. Doesn't that sound funny to you? Think about it. If you're tired, why would you want to be retired? Did you ever think about that? How about rejuvenated? That's what I was, rejuvenated, refocused. So why start it again? our job was not finished the first time. We never got the HDL therapy over the goal line. We are fortunate to have well-known venture capitalists who helped us on both coasts as well as locally. We had an experienced team and the former patents that we could use. We identified an HDL-focused partner in the people at the Cleveland Clinic, and we're able to get some intellectual property from them to get back into the HDL arena. Do you realize if we had stayed as a separate company, this 216 would be on the market right now? That's the part that bothers me the most. And there's a lot of people who would need that medication. I mentioned the facility in Plymouth Township. We got support and cooperation from a number of different private and public sectors and sector organizations. It was really a tremendous, I think, situation of necessity, let me put it that way, where we had an innovation we wanted to pursue, we had the business sense, and we had the history of being good business partners, and we had the opportunity to do things in an ethical way. And I think having that first Esperion experience has really helped us with the second one as well. And so we're operating as a virtually integrated biotech company. Here it is. Our spring's a little bit earlier than yours, sorry. Yeah, right. This is June. No, I'm not kidding, it's May. It's probably the end of May. And so one thing I wanted to also show you is that this is the difference between the two companies. If you look, okay, a 2-year time frame from when we started here, 2-year time frame in 2010. Venture capital, 43 million. We're at 35 million now, actually. The IPO was 62 million. No, it's not going to happen probably for another 3 or 4 years. Licensed IP, 4, 2. Business deals, 3, 1. CROs, 5, 40. So you've got to have people do the work. And unfortunately, those CROs and consultants are people that I've known and worked with for over 20 years. So I'm very lucky to have that. Colleagues, 70, 14. Actually, we just had an acceptance of 1, so it's 15. Research versus development, 80-20, 20-80. Start phase 1. There was a stage of development where we were able to do what we did in 2 years. End phase 1. We were humming. We were working really fast. And valuation of the company, 250 million at that point, 40. So it's a different world. I will never see 1.3 billion again, never. But that's okay. That's all right. That wasn't all that most important. So, lessons learned along the way. Do the best science that you can do. Translate its application to benefit human health. Don't eliminate your options. Develop competing alternatives and constantly reassess your prospects. Surround yourself with people who complement your strengths and your weaknesses. Never burn your bridges, no matter how chaotic the situation. Your colleagues are your teammates, not your adversaries. And never underestimate the resilience of you and your team. Be optimistic that opportunities abound. You have to be an optimist to do this. You can't be a pessimist. So, questions for the innovative entrepreneur? Any of you want to start your own business? Raise your hands. Come on, hi. I can't see them. Oh, that's great.